In this video, we'll talk about prostate-specific antigen, PSA. It is secreted from prostatic epithelium. So why it is secreted? It is a type of protease, right? So which is secreted in the semen to cleave the semen coagulum which is formed after ejaculation. So basically to cleave and liquefy the semen coagulum which is formed after ejaculation, this protease which is prostate-specific antigen is released in the body. So normally it is released by prostate epithelium. If it is exceeds in the number, it will leak out to the plasma. So normally the plasma level of this prostate-specific antigen is 4 ng per ml. But if it exceeding greater than 10 in the plasma, it is suggestive of any carcinoma of prostate or benign prostatic hyperplasia or prostatitis. So normally this PSA will be in the two forms. One is bound form and second is the free form. This bound form is a major form and the free form is a minor form. This bound form will be rising in the cancer of prostate, whereas this free form will be rising in the benign prostatic hyperplasia or the prostatitis. So what is said in that point, this PSA will be existing as bound form and the free form in the plasma. So if the plasma levels of this free form is rising, right, you can see this in the benign prostatic hyperplasia and prostatitis. If the plasma levels of this bound form of PSA is rising, you'll most probably see this bound form rising in the carcinoma of the prostate. So that is about that point. And this PSA elevation is not only specific for cancer, it can also be seen in benign prostatic hyperplasia, prostatitis, and also in the black men, this African race, and also bicycle riding men, right? So PSA will be raised very much in the carcinoma compared to the benign conditions. And serial estimation of PSA will tell you the degree of spread and the recurrence. For example, if it is rising greater than 10, it will suggest you of initial stages of carcinoma. But if it is rising greater than 35, it will be suggestive of advanced prostate cancer, right? And also decrease in the PSA after giving treatment will be called ablation is adequate, right? So what is happening, you can also check whether the treatment which you are giving for this cancer is working or not. So if there is any decrease in the PSA levels after giving the treatment, that means there will be adequate ablation. And men above the 50 years and the PSA greater than 3 ng per ml should go for biopsy, because sometimes PSA can give you false positive and the false negative results. So if you are suspecting any cancer in the patient, usually men above 50 years and PSA greater than 3, there is some underlying pathology of benign prostatic hyperplasia or cancer most probably. So that's why you'll advise a biopsy. So this is about PSA. If you summarize the whole thing, what is PSA? It is a prostate specific antigen which is a type of protease. It is secreted in the semen to liquefy the semen coagulum which is formed after ejaculation, right? Normal values in the plasma is 4. If it is exceeding greater than 10, you should suspect cancer, benign prostatic hyperplasia or prostatitis. Normally it will exist in the two forms. One is bound form and the second is a free form. Bound form will be rising in cancer. It is a major form. And free form will be rising in benign prostatic hyperplasia, prostatitis. It is a minor form. There will be some uses of PSA. One, you can suspect the degree of spread. If it is greater than 10, it will be initial stages. If it is greater than 35, it will be later stages of prostate cancer. And also you can suspect the type of pathology. One, if it is bound form rising, it will be cancer. If it is free form rising, it can be benign prostatic hyperplasia and the prostatitis. And third importance of this PSA is, you can know if the treatment is working or not. So if the decrease in the PSA levels after the therapy, it indicates adequate ablation. So these are the three uses of PSA, right? And also PSA will be very much increased in the carcinoma compared to the benign conditions. And men above 50 years with PSA above 3 ng should be advised for biopsy. So this is about it. Bye.